Community veterinary clinics that traverse the length and breadth of South Africa, providing cheap and often free pet care in about 80 disadvantaged communities. They have around 30 clinics reaching approximately 25,000 animals per year. So we're going to see exactly how it's done. And Ayanda is there with, I think it's Dr. Kate Morris, who's a private veterinarian from Pretoria. So let's just cross over to her and find out exactly what's going to be done right now on the show.
Well, a very good morning to you once again, Leanne. I'm still standing exactly where I was earlier, but just a stone's throw away from where we are is that van that goes to the communities and assists with those four-legged friends of ours. Dr. Kate is in fact inside, and she's going to be doing a practical demonstration of exactly what it is that they do. They check for fleas and ticks, and they vaccinate, and they sterilize and the like. But here to tell me a little bit more about the general health and well-being of the animals and what they do is Dr. Risa again. So she joins me again. So while Dr. Kate is showing the practical aspect of everything, Dr. Risa is going to give us a bit of theory. Doc, it's good to have you once again. Talk to me about how often we have to vaccinate the animals, because I just had a little puppy. He's about 7 weeks or so. So how soon do I start to vaccinate?
Okay, so good morning. He should be vaccinated between 6 and 8 weeks, then a booster vaccine between 10 and 12 weeks, and then another vaccine a month later, especially in the brown and tan dogs who tend to get parvovirus quite easily. We then, at 12 weeks, we vaccinate for rabies, which is what we call the zoonotic disease that humans can get, and most of you hopefully have heard of rabies. It is present in South Africa, and dogs are the main carrier to humans. So vaccinate at 12 weeks, then a booster a month later, and another booster preferably at 9 months, and then they should be done annually. So unfortunately, it does need boosting, but it's a super effective vaccine.
Mm-hmm. And talk to me a little bit about some behavioral issues that we might have in various communities that perhaps could increase the spread of disease among our pets.
Okay, well, obviously lack of vaccination is the biggest problem. So people breed their pets. There are a lot of unwanted breedings that are happening, so sterilization is extremely important. And then people don't know about vaccinating. And because we live in dense areas and we're on the edges of wild areas, dogs can become infected with something like rabies, maybe brought in by a foreign dog that's come to the area, bitten that dog. That dog is then living with you and your children, and the incubation period is variable, so your dog might not show that it has rabies. And when the start of the signs of rabies occurs, it's not classic.
What are those signs?
So that's what I wanted to say, is that sometimes the dog, when he's very, very friendly, will become a little bit shy of you and run away from you, and often doesn't like water.
Oh, we can hear Dr. Kate is busy with the vaccination there, and that dog is not too pleased with that injection. But it's for your well-being, little one, so you just need to bear with it a little bit. Yes, sorry, you were saying.
So she'll be fine, and the better part is that she's vaccinated than that she gets rabies. So that is a killer of not only dogs but of humans as well. It is a deadly disease. We have no way of treating it. People die when they get rabies. I can't emphasize that enough. Your dog will often become scared of water when it has rabies. That's another way of telling. They will froth at the mouth when they have rabies. That's another way of knowing. But if you're in any doubt that your dog is behaving in a very strange way, rather try and get some veterinary help than go in and interfere with it and get bitten yourself. If you've been bitten by one of these dogs, please seek medical attention. But number one, wash your wound. Wash, 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 wash. They say that that is the most effective way of stopping yourself getting rabies.
Oh my goodness. Talk to me now about some of the other work which you do, where you is it deparasite, or you get rid of the parasites that can also be very deadly?
Yes, so there are two things. We have internal parasites, which are worms. So we deworm the dogs regularly, starting when they're puppies and then going through into adulthood, and they should be done every 6 months. The other thing that we have a lot of problems with in South Africa especially is we have a lot of ticks, but we have fleas, and fleas are little taxis of disease as well. So by not controlling your flea infestation on your dogs, you could be bringing disease into your home.
Sure. That is so frightening. Another aspect that you've touched on, sterilization. I know you've delved into it a little bit, but let's perhaps bring it back as a subject matter now. How soon can you sterilize your pup?
Your puppy can be sterilized from anywhere from 4 to 6 months of age. So before they have a season, it's an old wives' tale that they should have a season so that they feel more like a woman or more mature. That is not true, and we actually know that we can prevent some other diseases by sterilizing them early. So get them done before they have their first season, before you see any blood from them, because that is the time to sterilize.
And how invasive is that procedure? Like, I mean, you talk about sterilization, and I'm just expecting blood and gore and all of that. So I'm wondering if you're going from community to community, how practical that is. How invasive is it?
It does require general anesthetic. We do give them pain medication. So it's, in a human sense, it's a hysterectomy. So we remove the ovaries and the uterus from the dog. It is an invasive surgery, but it's uncomplicated. We do a lot of them, and it's a 15-20 minute procedure from start to finish. So it's not a big deal.
And let's go into your area of expertise now. You're into horses, equine, I think is how you pronounce that word. Tell me about some of the diseases that you prevent among the horses. I know we touched on this a little bit earlier, but for the sake of those who've just joined in now, how does CVC assist in curbing the spread of disease among horses and humans?
Okay, so the biggest disease we have in Africa is a thing called African horse sickness, which is unique to Africa. It's spread by a midgie, and it's virulent, and it kills horses. There's no other way of putting it. We do know that by vaccinating the horses, we decrease the incidence. And horses need at least 5 vaccinations in order to develop an immunity. So it's not as good as the rabies vaccine. Horses should actually be vaccinated against rabies as well, because they're an animal who can transport rabies. So that in itself is another problem. Horses also get tetanus quite easily, which humans can get. So you can see that the relationship between humans and animals is very close, and caring for our animals allows us to care for our communities as well, and our children especially, who are very closely related to their animals.
And I love that you do this in Bizana, where I can imagine horses are not just loved as pets, but also as a practical means for transportation, for helping out in farm areas, for assisting. I mean, in the township where I grew up, we used donkeys, to transport coal, amalahla, and the like. And so it's a practical animal as well, and even more reason for us to look after it.
Not only are they practical for transport, we have a project that I'm just working on, which is getting children to ride their ponies to school to attend lessons so that they have a better ability to concentrate in class instead of walking to schools. So that is a project I've just begun in Bizana that I'm hoping to iron out. Wouldn't it be amazing if children could ride to school and not walk? And then they would be able to concentrate more at classes and not fall asleep.
Love it, love it. I'm hearing some silence from the bus at the moment, so which tells me that the pain is perhaps a little bit subsided for the pup who's getting the treatment from CVC. How long is the recovery period? You told me that when you sterilize, you do give them pain medication so that they recover. But let's say there's a vaccination or a deworming of some sort. How long is the recovery period?
It should be a few seconds. I think once the needle's out, it doesn't hurt. Sometimes it might itch a little bit. It's like us being vaccinated. Just give it a little rub, give them a pat, tell them it's okay. I think often they cry out of a fright because they didn't expect it more than actual pain. I don't think pain is such a problem. So it's quick.
Well done once again for the work that you do in all these communities with the under-resourced personnel who are really just trying to look after their loved ones but don't have the resources. So CVC goes into those far-flung areas, those communities, and assists them in providing healthcare for their pets, which is something that's a scarcity. I mean, there are not enough government-funded vets in South Africa. So you have a whopping 6 to 9 million dogs, and only 15% of them, yes, you heard right, 15% of them actually get treatment from vets. And that's why CVC stepped in and said for the 85% that do not have access to professional veterinary services, we will stand in the gap at a nominal fee just for the pet lover to have a sense of responsibility. They'll bring in about 10 Rand, 20 Rand, 50 Rand. Doesn't even cover the vaccination cost of the actual instrument. So it's just as a way of not creating dependency, but to empower the pet owners who also have a part to play in looking after their beloved animals. Let's leave it there for the time being, and as you can hear, there's no more noise coming from the little pup, so he's fully recovered. But it was quite an insightful, I think, conversation that we've had, and also for the signs of rabies. This is not just caring for animals. As we care for the animals, we also make sure that human beings who love them so much are kept safe and sound, so we curb the spread of rabies. It's also a prevention of a number of diseases that are tick-borne. So it's very, very important that we look after our loved ones for our own safety and health and well-being as well. Leanne, it's back to you in studio, and all from us for the time being.